So I've got a question for you. What is the difference between somebody who works in a setting like this in a clinical setting, seeing patients on a regular daily basis? That might be post-op patients, pre-op patients, might be car accident patients, work comp patients. Doesn't matter if they're paying cash or paying insurance, but what's the difference between a clinician who's working in a setting like this and somebody who may not be a clinician, but is working with a similar patient population, even though they're not patients, because you're working in more of a setting like this? So if you are a strength coach or a personal trainer that's working in a gym, or you might be working out of a PT clinic, what's the difference between what you're doing in your setting, which is more like this, than that clinical setting, that office setting? My take is there's not a lot of difference, all right? So you might be working with people that are healthy and that are training to get better at something, or maybe they're not 100% and they're coming back off of an injury. So they saw somebody in a clinical setting, they've been handed off to you, and now it's your job to take them back to full play, to competition level, to help them get a college scholarship, win a state championship, whatever it is. My take is not a lot of difference. So as a clinician, when I'm in there, I need to understand what is going on with my patients biomechanically. I need to know what's going on with them psychologically. I need to know what's going on with them neuromuscularly on a physiological level. If you're dealing with patients or athletes or people that are trying to do something in this type of setting, you need to know what's going on biomechanically. You need to know what's going on psychologically, and hopefully you understand the ins and outs of neuromuscular physiology, human physiology, so you can apply that in this setting. So there's not a lot of difference. So if you're somebody who works in this setting and you have questions about how to take somebody back to play, what exercises they should be doing, what you should be looking at as far as benchmarks, or what should they be able to do with exercise A before you take them to B and C and D, what kind of screening tool should you be using to get through a full total body functional screen to understand what their starting point is, and how do you communicate with the person that works in that setting over there? So for you people that are strength coaches or personal trainers, or you're going through school to be one of those things, and you want to learn more about what we do in the clinical setting and how you can apply that, yes, you can apply a lot of the things that we do in that other setting, and you should be applying those things, because if you're not applying those things, then you're going to run into problems. Your athletes and your clients are going to run into problems, and then your business runs into problems. Then you're out looking for more clients, okay? Don't do that to yourself. What you should be doing is getting into our MoStreBility product, which will take you through what happens in there, how you can apply it here, breaking down physiology, anatomy, biomechanics, teaching you how to screen your athletes quickly, and why you should be screening your athletes on a regular basis, like every visit basis, so you can see progression, especially if you're dealing with people that are coming off of injury. And no, I'm not talking about doing a 45-minute to an hour-long functional screen. I'm talking about doing a 1-minute screen that will tell you everything that you need to know, so you know what your starting point is and where you are going. That's what the MoStreBility product will do for you. Now, if you're a clinician and you feel like you didn't get a great education in school about exercise, which you probably didn't, because PT school does a lousy job of teaching you the pertinent information when it comes to exercise prescription and progression. It also doesn't do a great job of teaching you biomechanics and how functional anatomy is different than picture anatomy. Two completely different things. So when I ask PT students when they come here on their rotation, one of the first questions I ask them week 1 is, well, tell me what the function of the soleus is. And every single one of them says plantar flexion. And I say, no, that's the picture function of the soleus. I want to know what the functional function of the soleus. What does the soleus do when people are functioning? It does not do plantar flexion. And so when I say, well, the primary function of the soleus is knee flexion, they say one of two things. What? Or, well, that can't be because the soleus doesn't cross the knee. So if you don't understand that, if you don't understand why the soleus is primary job is knee flexion, then you should not be treating people that walk with their feet on the ground, which should be everybody, okay? You are deficient in biomechanics, functional anatomy, critical thinking, and the application of neuromuscular physiology when you come out of PT school, because PT school's focus is not to turn you into a clinician, it's to turn you into somebody who can pass boards and be an average generalist physical therapist who doesn't understand the basics. So that's why you should also be taking MoStreBility. Now, if you have a fantastic grasp of all that, then you can move into the shift, and then we will take all of that information and teach you how to grow that into your own business. So if you are in this setting or if you are in that setting, it doesn't matter. You need to understand, have a deep understanding, and this stuff needs to come off the top of your head like this, because you don't have time to think when you're in this setting. Your athletes want to know what they're doing now and what they should be doing and what you're going to have them do and how you're going to help them reach their goals. Just like if you're a clinician working in that setting, your patients want to know what they need to do to get back to doing whatever it is they want to do. And you can't sit down and think about it and look through your textbook, and you sure as hell don't have time to go read the research and go for evidence-based practice. What you should be doing is using science that we know is 100% correct and applying that in the clinic. So if you're having issues either functioning in that setting or functioning in this setting, or if you think that you're a personal trainer or a strength coach and you think that you're doing things that are that much different than clinicians are, I'm here to tell you, you're not. And as soon as you know how to think like a clinician, a good clinician, not a generalist who just passed boards, but somebody who is actually at the top of their game as a clinician, as soon as you, as a personal trainer or a strength coach, a performance coach, can think on that level, your clientele will explode, your business will explode, and you'll be doing things that you never thought possible just because you finally learned how to apply the basics that those people in that setting should know and that you in this setting should know. And the best way to do that, the best way to kickstart that is to get into MoStreBility.